Okay, take it away.
Alright, I'm going to talk about canine osteosarcoma today. The reason I picked this topic is because I had a dog that actually had that, and I will talk about that. So first off, it's a malignant tumor of the bone, which has an increase of osteoblasts with destruction of the normal bone. So osteoblasts, which are cells that secrete the matrix for bone formation, so pretty much it attacks the bone and it destroys the normal bone. So osteosarcoma, it's the most common bone tumor, and it's more common in larger breeds of dogs, and it's very common in older dogs. And it's extremely aggressive, and most of the time it's malignant, which means it spreads throughout the body. The causes of osteosarcoma are not really known right now. They've linked a lot of it to genetics, and a lot of times it could come from other places, such as if you have like a foreign body in your dog. If at some point they had like a metal implant inserted in their leg, you'll see that the tumors will develop in that area. Or if your dog had broken its leg when they were younger, a lot of time in that spot where it healed, it becomes weak over time, and then the cancer will step in. The symptoms for it, at first they're very subtle and you don't really notice that your dog is getting it. You'll notice some swelling in the area at the beginning and lameness. They'll be limping. They'll have some joint or bone pain, and they'll be, like my dog, he had licked the site of it a lot, which it indicated that he was in pain in that area. And then lastly, as you can see by the picture right there, that's where the tumor has grown, and you'll get like a mass right there, an inflammation at the site where it develops.
Now, before you go on, Rachel, now, that's not your dog, right?
No,
You're talking
that
about
is a
past
Greyhound,
dog, right?
Yeah. That's a picture I got off the internet.
Okay.
But that's exactly where my dog had his.
Okay, yeah, and I had a neighbor that had an Irish Wolfhound that had one of these in the front joint, I think it was the front left leg, and it kind of started out with pain and licking, and then, you know, it's my neighbor's dog, so I don't see it every day. I might have saw it like every 5 days, and every 5 days I could tell it was growing. I mean, it was like
Very aggressive.
stunning. It was like you see a little lump, and then it was actually bigger than that at the end when they euthanized the dog. Because, you know, big Irish Wolfhound, if you take off that front left leg, I'm not sure, anybody ever seen like really tall dogs that have like are three-legged? That's kind of hard for them. And so, but it was stunning how fast it was growing. I think at the end it was like maybe well, baseball size for sure. But every 5 days I could tell, wow,
Yeah.
this is not good.
Yeah. So to diagnose it, you do X-rays, which will determine the stage of which it's at, and then biopsies, which you'll just take a biopsy of the bone, and then last you can do blood tests to diagnose it. And then the treatment, that's where he was talking about, you can amputate, which that's the first option. It results in removal of the disease, but only at the site. A lot of times, the problem with osteosarcoma is it's very aggressive, and normally when it starts, it's a very good chance it has already spread to the lungs. And you can do chest x-rays, but a lot of times they're very microscopic at the beginning, and you can only see them when they're about 2 millimeters in size, and more than likely it has already spread.
Yeah, once you see that knot on the leg, it's got probably already over. You know, it's all over. Yeah.
Yeah, and then amputation. It kind of depends on the breed of dog that you have. If you kind of want to amputate, like Greyhounds, they're really not the best breed to do that with. Other dogs maybe, but the other one is the limb sparing surgery, which that one you probably would want to place second to amputation. With the limb sparing, a lot of times there's a lot of complications with it. You'll have failure, and then the tumor might reoccur, or there's a lot of chances with infection after the surgery. So not really one is more effective than the other, but a lot of times with amputation, you kind of see like less pain and overall, because limb sparing, there can be a lot of complications with it. Next, prognosis. I put this on here mainly just to like represent like how this cancer is very aggressive. A lot of times the survival rate with surgery and chemo is normally about 1 year. And then if the dog is younger than 7 and it's located on the proximal humerus, which is like up near the shoulder, they really only survive about another 7 months. And then dogs age 7 to 10, they have a greater survival rate than younger dogs versus older dogs. That's kind of the best age if you're going to get the best results. And then an axial osteosarcoma, that one's actually like within the body, and you see a lot lower survival rate. Only about you can get additional like 4 to 5 months, just because you can't do surgery in that area, and it probably will like reoccur. So my personal experience with it, we adopted a Greyhound off the track when he was 2. We rescued him. He had a good life with us. We had 10 years with him. And what had happened in March of 2016, he was displaying the signs of pain, and my mom is a small animal veterinarian, so she caught on to what was kind of happening. So she did the x-rays, and we could see that it was starting to grow. So at that point, we knew that we couldn't really do an amputation with Reggie because he was already like such a klutz the way it was, and we knew that his balance wasn't the best, so we eliminated that. And we didn't even want to try limb sparing just because it was probably in the lungs already. So my mom started off with the treatment of vetprofen, which was an anti-inflammatory, and that lasted him until about August. It took away all of his pain. You wouldn't even know he was in pain.
So that's pretty good right there.
Yeah, that additional time with the dog at his age of 10, that was phenomenal.
And was there a lump then?
Yes, there was. And
Up here at March?
Yep, a little. That's when we noticed the licking, and it was starting to swell. And then by August, there was distinctly a spot, like in that picture at the beginning. And that's whenever, around that time, my mom actually went to this, at Ohio State, there was a Midwest Vet Conference, where actually there was a speaker that was speaking particularly about bone cancer in dogs, which was kind of good timing. And down there, they actually recommended, Tramadol she was doing, which that was already one thing, but then gabapentin, which is actually a new drug introduced in the vet world. It's not FDA approved yet, but vets are finding really good results with it. So it's kind of an experimental treatment my mom tried on our dog. It really worked wonders. What it does is it blocked nerve pain to the tumor, and you could not tell that Reggie was in pain at all from it. It was so successful. And then around the time of January 2017, that's when we noticed his breathing had gotten worse, and we knew that it was in the lungs, and by then the gabapentin had worn off. So in January, we made the decision. My mom's best call was to put him down then. So, but luckily we had all this additional time. So my mom is now recommending that to patients based off like their criteria if they fit it. She really has seen so much success. So
about 10 months more. That's pretty good.
We had a lot of success with our Reggie, especially with his age. So
did you say where his tumor was?
It was, actually right where you're pointing right there. That was it. You can probably see it because at that time he had some growth right then, but he just loved his walks, so we would just kind of walk around the yard and make it really short. But yeah.
And he was how old then?
10.
10.
Yeah. And we adopted him around 1.5 to 2, which is a really early age to get the dogs off the track, which increases their lifespan.
And what track did he race at?
Daytona, Florida.
Oh, okay.
Yeah.
Because are they still racing horses? I mean, not horses, but dogs places?
They have done a lot of work with shutting them down now, just because of the treatment. So we got him from a foster lady. Actually, Reggie came into my mom's clinic, and my mom saw those eyes and just fell in love with them.
Okay.
And that's when we adopted him. So.
Okay. I think you got a question back there.
If you have the pain controlled by what you were doing before with the vetprofen and the tramadol, why would your mom or any dog owner switch medications?
At that time, it had stopped working. The vetprofen and the tramadol wasn't working anymore, and he was in he was in pain, and we could tell. So at that point, we had the decision: should we try gabapentin or should we euthanize? Which mostly before the gabapentin, you would euthanize at that time. So we had a lot of luck. Obviously, we wouldn't keep him if we knew he was in severe pain, but the gabapentin had a lot of success.
So kind of the effectiveness wore off.
Yes, exactly.
Okay.
It became so big that it just was
okay, so
much
probably
pain.
overwhelmed that. So, because sometimes, this would be a good topic for somebody, sometimes when you give a lot of compound X to an animal, then they metabolize it faster over time, like the liver. can adjust how fast it metabolizes things. And I mean, I don't know if that's it or if it just got too big and then that dose wasn't, you know, effective and you had to go to something more effective. I don't know. There's,
So it's like kind of a question and kind of a comment. So like my sister has fibromyalgia and they use gabapentin for that.
Mm.
So I didn't know if there was like other uses other than just for like osteosarcoma.
oh yeah.
They use it in dogs for seizures too.
Oh.
But yeah, a lot of vet, it's just really new in the vet world right now.
So it sounds like it's in the human, maybe it
Yeah,
was in
It's
humans
still,
first.
it's still experimental for humans too.
Oh, really?
But like
Okay.
that, there's no cure for fibromyalgia.
Yeah, and which is nerve pain, right?
Yeah,
Isn't that
yeah.
it?
Yeah.
Yeah. That's, yeah. A lot of times, some compounds have multiple uses. Like the one I have used in cattle is like dexamethasone. And I'll tell you what, I mean, it's amazing. I used to induce parturition in cattle with that. I mean, it's used for an anti-inflammatory and everything. I mean, it's just amazing how multiple things can be. There's somebody over there.
I was just curious because I don't really know a whole lot about dog racing. Like, how long are they used? Like, what are the conditions that you were mentioning? Like, obviously, it seems
Yeah, that's a good
like
question.
not the best
Yeah.
situation for them. So,
Yeah.
tell me about that.
Yeah, so a lot of times, well, down there, like in Daytona and any other.
Now you're saying
they-
Florida. Yeah,
Yeah,
I mean,
yeah.
obviously, yeah.
Yeah, Florida. They breed them specifically for the racing, and then they will have, or it depends on how well your dog actually likes it. Like Reggie, we got actually a whole like thing of his records, and a lot of it said he just like wasn't into it. Like they have like a rabbit that goes around, they all chase the rabbit. Some dogs will really like it, some dogs really won't. So if you get dogs like Reggie who really didn't have interest in it, they kicked them off about 1.5 years off. And a lot of times they euthanize them. So that's where these rescue groups come in and save them. But normally if you get a dog that's like really strong and dedicated to it, they normally go to about 2.5 to 3 years old.
And do they live in people's homes? Do they stay in a kennel?
And at
The
racing
housing?
tracks, they live in very small kennels. And the quality of life down there, I mean, personally, in my opinion, it's not the best because they have time feedings and they put out food and whatever they can eat and they take it away. So when we got Reggie, he like would just eat everything in like 30 seconds. And over time we had to show him it's okay. These dogs never got out of the track. Reggie had never seen stairs in his life. So at 2 years old, a big 80-pound Greyhound, we had to teach him how to go upstairs. So yeah, to answer your questions, about 3 is like the top peak.
I just didn't know.
There's some horror stories. I remember someplace in California one time there was an orange grove and the people that were picking oranges way back in the back of the orange grove, they found a pile of dead Greyhound dogs that had just been all shot. I mean, like, they might have been, you know, like spent, let's put it that way. And then, I mean, I don't know if there was like 30, 40, 50 dogs in a pile. Somebody just got rid of them.
Yeah, they just don't view him as
No, they don't view them as a companion at
Not
all.
at all. Just for money. And if they don't do their job, they're out. So.
Yeah. Kind of sad stories. That's why I think there's less and less of that.
Yeah, the groups have really came in, a lot of shutdowns. It's,
Yeah.
it's really, it's a good thing.
And then it's controversial racehorsing too, right? I mean, kind of controversial. And so are zoos. We could talk about controversial things forever, right?
Yeah.
Dog fighting, I mean, that's not very controversial. That's terrible from the get-go. So, are you done?
Yeah.
Oh, excellent.
That's it.
Sources and yeah. Okay.